Gaurav.
A very good morning to all. At the outset, I would like to thank AIOC and Dr. Sushmita and Dr. Panda for giving me this opportunity to speak in front of you. So, as ma'am has pointed out that red is not always abnormal and green is not always normal. So, going back to the basics, I'll be telling what is normal, what is abnormal, what is red, what is green, so that we can interpret it in a better way. So, OCT, the technology came in 1990 by Nahiro and James gave it this, and it is based on optical interferometry. The principle is basically different biological tissues have different light reflecting properties. So this machine uses that the echo time delay of backscattered light to give images. So basically, there are three main parameters relevant to detection of glaucomatous loss on OCT. That is retinal nerve fiber layer, the optic nerve head, and the ganglion cell complex. So all these three we can get on OCTs. So initially, the time domain OCT came, which just look at the echo time delay and give images. Then the spectral domain OCT came, which added a spectrometer, which uses that spectrometer to give more enhanced images. And the latest is now the swept source OCT, which has a higher wavelength, that is 1050, to give more enhanced depth in the images. So this is a routine OCT printout, no financial interest. So first we need to see what all is there in a routine OCT printout and what all we need to check. So there is our basic parameters and a signal strength. Then we need to look at the key parameters of the disk. This is the RNFL thickness map. This is the deviation map. This is a neuroretinal rim thickness curve. This is a RNFL testnet graph. Then the RNFL quadrant, RNFL clockers. So these all things we get on a routine OCT printout. So we'll look each separately. So initially the patient ID is very important. Many times our technicians do the OCT and they put wrong age or something like that, because OCT gives data on the base of normative database. If we will put age, sex differently, then the readings will not be accurate. And also it will only compare for normative database more than 18 years of age. So if we do a OCT scan of a child, then the readings will not be same. The most important here is the signal strength. We need to always look at the signal strength, because if the signal strength is low, the images will not be good and it will point out red. So the range is usually 0 to 10. So anything above 6 is acceptable. Like in this scan, we can see 8 is the signal strength. So OCT automatically outlines the optic nerve head, optic cup, disc borders, and also calculate more objective measurements such as optic disc area, neuroretinal rim area, in addition to the average vertical cup to disc ratio. So a 3.4 mm circle, RNFL circle, is always centered in the same spot within the cube, and it calculates RNFL thickness according to that circle. So these are the key parameters what all we get. So optic nerve head, optic cup, and disc borders is outlined. Then we get optic disc area, neuroretinal rim area. So everything is compared with the normative database, and it is pointed in red, yellow, and green. So in glaucoma, there is accelerated death of retinal ganglion cells and RNFL axon, resulting in characteristic visual field defects and corresponding optic nerve head changes. So OCT can directly measure and quantify RNFL thickness by calculating the area between ILM and RNFL border. So here we can see that 3.4 mm scan centered on the Brooks membrane is there, and the cube is 6 into 6 mm. So this is the thickness map. Here we need to see that the color coded thickness map is there. The blue is the complete blue is 0 and the complete red is higher. So this is a normal hourglass pattern, that there is more thickness in the superior and the inferior quadrant. The main thing I wanted to point out here is that it has to be completely colored from blue, red, or yellow. It doesn't need to be black in any area. If the area is black in somewhere between, then it means the image has not been picked up. Then it will falsely give a thinning in that areas. Also, small optic disc, long axial length, and older rays are associated with thinner RNFL. So this is an RNFL deviation map. So this is basically gives the absolute data, and it is deviation map. That is deviation from the normative database. So the gray here means it is normal, that it is not deviated. But in some areas, we can see yellow or red in the localized map. So it compares each point with the normative database. So small localized defects can be easily picked up many a time because RNFL thickness comes at this 3.4 mm circle. But some areas like over here and over here, then localized defects can be easily picked up seeing at this grayscale map. This is a neuroretinal rim thickness curve. It has to be a double ham pattern. And this is a Tisnet curve. In Tisnet curve, here we can see the green, yellow, and the red. So this curve is compared with the normal normative database. So now, what is red? Does red means it is abnormal? No. Red just means that the data which we are getting is thinner than the 99% of the normative database. It may or may not be normal. Yellow means it is 1 to 5% of the normative database. And white, many times we see it comes white. So we see it is normal, but white doesn't mean it is normal. It means it is higher than the normative database, because in cases of like edema also we can get higher thickness also, and in small disc also the thickness increase in those areas. So here this is a RFN quadrant map, and this is a clock hour map. So it gives thickness in each clock hour. So now I'll be coming to the ganglion cell analysis. The ganglion cell layer is thickest in the perimacular region, and decreased total macular thickness has been absorbed in glaucomatous eyes. So ganglion cell analysis consists of combined ganglion cell layer thickness and the inner plexiform layer thickness. So similar color coding is there in this also. Here we can see that right eye, there is complete red and yellow pattern, and here you can see the upper part is getting blue. It means there is a decreased thickness, and the color map also it is red. So this thing is very important in subtle changes. So with this, I would like to thank everyone.
Thank you. Thanks, Gaurav.